Hi, I'm Michelle Rupp, host of AFMC TV. Thank you for joining us. AFMC TV is a place to consider as a healthcare hub. AFMC is a healthcare nonprofit. We specialize in making our lives, businesses, and communities healthy. This space was created to share information with the community. You'll hear from healthcare experts on a broad range of topics. Medical topics like immunizations and telehealth, to lifestyle topics like strengthening a routine or keeping your family hydrated. Our promise to you is to keep you informed in a digital way, providing useful information to you and your family. Again, thank you for joining us and welcome to AFMC TV. About the vaccine. In the next hour,
very hard to play. This video will provide ideas and also make sure
This week, we are kicking off a new segment called Catch Up on Your Checkups. We've only got about 5 months left in 2021, if you can imagine. So there's not a lot of time left to get some of the necessary checkups that we really need to be having. And so to kick off our segment, we are starting with Dr. Zimmerman out of Unity Health in Searcy. And Dr. Zimmerman, first of all, thank you for joining us today on AFMC TV. Wanted to first talk about the importance of having that primary care physician. If we need to catch up on our checkup, we probably need to start with our PCP, right?
Oh, absolutely, Michelle. And first of all, thank you for having me today. I'm very happy to help you on this. This is such a very important subject for us to address. Your primary care physician is your gateway keeper for healthcare, for your healthcare in all areas. And now during a pandemic is the most important time for us to have a primary care physician. The pandemic alone has created a situation where patients have had some barriers to finding their healthcare provider and getting in for their wellness checks and their routine health maintenance. The pandemic is also a very stressed time for our healthcare system. So it's even more important for you to have a primary care physician to help expedite your care through our fragmented healthcare system today. This is a time in our society where people are moving toward I like to call it the fast food environment, where they can get on telemedicine and find a doctor. They can get on the internet and ask a medical question. They can actually get medicines prescribed via telemedicine. Yes, is it efficient? Is it fast? Is it like going through the drive-through at a fast food restaurant? You betcha. But unfortunately, it does create barriers to your wellness and to your overall health care, because a primary care physician, someone that you go in and you get your health maintenance all tuned up for routine issues, for potential problems that might come down the road, is very important to have, especially in a time of pandemic. This COVID-19 pandemic has really created a whole different situation for primary care physicians. Imagine you get sick with coronavirus and you find yourself with diabetes, and all of a sudden you want monoclonal antibodies within 2 days of getting sick. The only way you're going to get that monoclonal antibody is through a primary care physician. And if you're established with one, they can expedite your care directly to monoclonal antibodies and get that necessary life-saving treatment to you if you happen, unfortunately, to contract COVID-19. But a primary care physician does so many other things. It's also the time during a pandemic to get your health maintenance up to date, your diabetes tightly controlled, your blood pressure well controlled. If you have COPD or asthma, that under excellent control, because we know that those patients who contract COVID-19 that have these underlying diseases are at the highest risk of hospitalization and even death. And your primary care physician can really keep all of those chronic diseases fine-tuned by having your routine health maintenance done periodically to keep you protected. And that's what a primary care physician and wellness does for patients and in a protective, layered way to just keep things in check for them. So they have excellent outcomes and maintain a healthy lifestyle.
And just in our last few seconds that we have, it's also a great way, having that established relationship, you as a patient would have an opportunity to maybe see what might be coming down the road. For example, if you maybe are borderline diabetic, you're able to maybe take some measures, change up how you're eating, do some exercise, so that in 6 months or in 12 months, when you come back, you aren't fully into irreversible diabetes. And so it is a great way to prevent some things from happening.
Yes, you're absolutely correct, Michelle, because with diabetes, it's the little changes that we make along the way that keep our patients well and healthy. And it's diabetes, like many diseases, they're a work in progress. They're not stagnant. They do change from time to time because our behaviors as humans change from time to time. We have Christmas time. We have when we eat more. We have winter time with massive snow events where we don't get out and exercise. All those things contribute to the wellness of your chronic disease, such as diabetes, which is an excellent example. Same with hypertension and COPD or asthma. You have to maintain those things just like you maintain your car in your garage. You would go get your oil changed in your car. You would go get the tires rotated. Well, to be healthy and age in a timeless manner, we like to say timeless. We hope we don't age quickly. Health maintenance is the best way, and wellness checks are the best way to stay on top of not only any potential diseases you have, but to catch those potential ones that might be on your doorstep in a year or two, and maybe ward them off and keep them from becoming a major issue in your life.
My last question in these last 30 seconds, if someone does not have a primary care physician, what is your recommendation to find someone in your community? Do you do a Google search? Do you ask your friends and family? Do you do both?
Now, that's a great question, because I'm not a huge fan of Google, but everybody uses it. I recognize that. But I want your viewers to understand there are some new technologies out there that are available that they can download on their smartphone, where they can get all of their health maintenance in one place. One of them is called the Share Care app, and it's free. And you can download it, and it will sort your medications. It will put your healthcare team together of the doctors you currently see. It'll help you search for new doctors in your area and their specialties. And it also helps you manage your health insurance, your dental insurance, and all those items in one place, along with being a search engine like WebMD to get on and look up information about your conditions. So I encourage most of my patients to have, I call it a health management app on their phone, and then they can bring all their information. They track their blood sugars on it. They track their blood pressures for me. And it's just a great one place area where I can just look and see what their blood sugars have been running for the past 30 days. And we're really in tune together as patient and doctor.
That's fantastic. Great advice. Thank you so much for sharing that. And thank you for joining us on the show today.
Thank you for having me.
Jamie Mayo with Nabholz Construction joins me now. And Jamie, we are talking about some of those great habits that we put in place, and now school's starting. And so we're going to throw a wrench in the wheel. How do we keep some of those good habits in place at the beginning of a new school year?
First of all, I just want to say thank y'all. I'm so excited to be here with AFMC TV. This is really great. So I'm Jamie Mayo from Nabholz. Great question, Michelle. A lot of stuff going on. A lot of changes are probably happening in homes. And the first thing to do is if y'all have made these changes, then my hope is that you can continue them. There are two things. One, some are time sensitive. So as your schedules change, you may have to get up earlier, you may have to go to bed earlier. So part of that is if you're trying to exercise, if you're trying to do your laundry, if you're trying to pay your bills. So if you've got these good habits in place, is really planning, making sure that, again, you have scheduled some time in to get up 15 minutes earlier, go to bed 15 minutes earlier. Maybe it's setting your clothes out the night before. So again, it's making sure that you're making time, you're planning for things that are going to be altered. And then the other is just to stay committed and continue doing the things that you already are doing.
When we talk about habits, I've heard it say that it takes 21 days to develop a habit. Maybe that's true. Maybe it takes shorter. Maybe it takes longer. But I would think too that there's an element of prioritization when forming a habit, and that it is a priority to you, and it becomes a habit, a good habit versus a bad habit.
No, absolutely. I couldn't agree more. And it's funny, I was thinking about a habit, the 21-day thing. I don't know if I believe that either, because there are some things I've done for 21 days and I think I probably shouldn't keep doing this for another 21 days. And there are some things like, oh man, I feel so good. It didn't take me 21 days to realize that and to continue that. But you are absolutely right when you talk about priority. You got to find that one thing that's so important to you that you go, I really want to keep doing this. And it can be things like, I want to be able to continue playing with my children or my grandchildren. So I'm going to have to make sure I'm strong enough or flexible enough to get on the floor and get off the floor. Maybe it's your health. Maybe you're trying to quit using tobacco and you go, I really need to do this for longer than 21 days. It is a priority for me to be as healthy as I can, whether it's my lung health, my financial health, my physical health. But you're so right, finding that one thing and making it a foundation when you look at these are behaviors that I want to continue doing so that I can continue doing things that I really enjoy, or prevent consequences that I know will happen if I don't make this a priority in my life.
Sometimes getting on the floor is not the problem. It's getting off the floor, right? Sometimes. We're talking a lot here about adults and about habits that adults should make. What are some quick takeaways that we could begin investing in our children to create good, healthy habits, sustainable habits?
So I think I'm a planner and I'm an organizer, and I kudos to folks who don't plan and don't organize. I don't know how y'all do it, but I really would encourage y'all, like I said, and my mom taught me, we're going to look at what we're going to wear tomorrow. We're going to look at the weather. We're going to make some plans. We would always have our stuff in our backpack. We had that ready to go. We would maybe put it in our room or by the back door. For us, it was, are you going to eat breakfast? If so, what? And we had those, they're not the best, but those little oatmeal packets, and we would have to set those out, get our bowl, get our spoon. We function better when we know what we're going to be doing with our time versus, my hair's on fire and you go here and you do this and you do that. So I would say anything that you can instill in your kids is really about planning and prepping for the most part. And that kind of that time management is a great skill. And here's the other thing I want to say. I want y'all to instill in your children the importance of having some time to themselves. I see so many women, especially moms, y'all are the best moms in the world, but you're not taking care of yourself. You are sacrificing so much for your children, and that's a gift. But I'm really going to encourage you ladies and guys is to do something for yourself, whether it's 10 minutes in the morning, whether it's your devotion time or your exercise or your quiet time. Kids need to see that it's okay to sit and be quiet and not have an electronic in their hand. They need you to be healthy so that they can be healthy too.
Jamie, that's great advice. Fantastic. I couldn't have said it any better myself. So we will leave it with the professional. Jamie, thank you very much for that great insight. Thank you.
Thank you. Enjoyed being here.
And thank you for joining us for this week's episode of AFMC TV. Next week, we are catching up on our checkups. We're talking about hearing, we're talking about vision, and we're also going to let you know about this year's 5th ACES Summit that AFMC is a proud sponsor of. We hope you'll join us next Wednesday.